Getting a job as a dentist is not that hard, but getting the right job where you actually feel supported, grow your skills, and you don't have to compromise, that's the hard part. So in this video, I will show you how to avoid that and how to choose a clinic that actually aligns with your goals. Hi, I'm Esther, a dentist and a clinical educator based in Ireland. On this channel, I share practical strategies to help dentists manage daily mental challenges and build a healthier and more balanced life. And this is exactly why I created a free digital workbook to guide you step by step through the process of choosing the right clinic, asking the right question, and making a confident decision. Who should use this workbook? I recommend it fresh dental graduate, congratulations by the way, who is applying for their first dental position and you don't have any idea what type of question to ask during an interview. Final year dental student, try to understand the job search procedure. Early career dentists who try to avoid a poor fitting working place and let's say have a bad experience before. I would like to highlight here, this workbook, it's only a guidance and educational purpose only. So always check the local regulation when making any type of decision. How should you use this workbook? If you click the link below, that will lead you a website where here you put your email and get your free workbook. You need to check your emails as you will receive two emails. The number one is a confirmation email. Then you will receive your second email, which is included the free dental interview workbook. So click on the download button and then you can edit this. So this is how it looks like, the first dental job workbook, a step-by-step guide to evaluate dental clinics before accepting your dental job. How to use this workbook? Choosing a random dental job without a system is similar to assembling an IKEA furniture without the instructions. So this workbook acts as a career instruction manual. Here we will talk about 5 main basic points. You can see these icons represents those topics. Number 1 is the magnifier, that's the research the clinic before you attend any interview. Ask structured questions. That's more about the interview process. We will use Scorecard, and then the compensation clarity. You need to have an understanding about the payment structure, and then you can compare multiple job offers. Your career goal. So you need to define what your direction. Very similar, if you are driving a car, you need to know where to drive. Answer the following 3 questions. What procedure do I want to develop? To help you, I will fill out as well, so then it will give you a bit of idea. Let's say I am interested in endodontics and I would like to, let's say, improve how to use rotary files and apex locator, and also let's say how to learn CBCT scan to find canals like MB2. What type of clinic environment suits me best? Which type of working place you would like to work? In order to get an endodontics, you might need a family practice, or you are interested in corporate dentistry. There are multiple specialists and maybe there is an endo specialist who could mentor you. Technology. What mentorship support do I need? I need someone on clinics to help me available after working hours. So now you know your direction. We need to research that clinic. So let's say you see a job advertisement. They're also highlighting they are looking for new graduates. I created here a checklist which will help you to go through the important steps. Review the clinic's website. I searched for a clinic. It's called in Australia the Maven Dental Burwood. You would like to join to this clinic. Again, this clinic it's not advertising or anything. I just find them online, and all this content again it's coming whatever is visible on the public. So the clinic have a website. I can see here they have like opening hours. You can see the exact location. You can see the services. Let's go back on that checklist. So we review the clinic website. It exists. Check service offered. So again, let's go back and have a look. which type of treatment do they offer. So remember, you are really looking for endo. You can see here that they definitely have root canal treatments. Again, review the dental team, meet the clinicians. Great. So here we will click and meet with the clinicians. Let's say this is Dr. Calso. Probably he is the owner, or he works since February 2013. We have another experienced dentist here, 30 years of experience in general dentistry. Could you see me what I'm doing? So here I'm just go through the pages and have a look. If I would like to work in this clinic, that might be my colleagues. The patient's demographics will give you an overview which type of patient will attend to a clinic. Check the technology used and look at this picture. This is the main person who works there since 2013 and using a microscope. The main aim was here to find a mentor who can help you. The clinic fit method is actually a 5-minute exercise after you leave the clinic. Think about like you are your patient. Check 3 things. How is the service? How was the team? What was the patient profile? It's family dentistry, cosmetic, ortho. What was general speaking the vibe? Give the score. In this case, I added here stars, but give the score overall speaking. How was the feeling about the clinic? Review your CV. You need to be able to talk about your experiences. You need to prepare examples of clinical cases. Also, prepare thoughtful questions and research the clinic or the owners. Based on the Instagram and the website, we see that the main person is probably the owner. Here you can see show more. Copy this whole text here, and then you can open ChatGPT and you can ask, give me 3 key questions for a new graduate who would like to join to this clinic and interested in endodontics, and the interview profile based on the website. And actually what you can do, you can copy and paste. ChatGPT will help you to list 3 questions. Let's say, give your experience with complex cases and referrals. How do you support the new graduates in building confidence and competence in endodontic treatments, especially early years? You have a strong interest in root canal therapy and comprehensive care. How do you approach decision-making between endodontic treatment and alternatives like implants in complex cases? What learning pathways or courses would you recommend for a new graduate aiming to develop a high level of skills in endodontics? It's 3 key questions. You can write it here. Essential interview questions. No matter if you're talking to a recruiter or a principal dentist or a practice manager, there are 4 areas where you definitely need to talk about during an interview. The number 1 is the role clarity, the mentorship, the patient, and the salary. The role clarity. What procedure will I be expected to perform? So if this clinic in the job advertisement doesn't specify, then you need to ask and make sure you understand this is like a general dentist role, or you need to be comfortable treating children or any people with special need. The mentorship. Can I discuss cases with the senior clinicians? Patient. How are patients distributed among associates, and how is the percentage calculated? So here you will see Clinic A, Clinic B, and Clinic C, because if you have 3 different clinics you would like to consider their opportunities, you can write those here. So make sure you write the clinic's name, the date, and you can hear any type of notes. Scorecards. So why use a scorecard? Because you can evaluate a clinic objectively. Using a scorecard helps you remove emotional bias, compare clinics objectively, and identify potential risk. How to score these scorecards? My recommendation, give a number 1, 3, or 5 for each category based on the interview and your clinic research. Scorecard number 1 is the role and an expectation. So this is the minimum requirements. Areas like role clarity, how clearly explain to you what needs to be done in this clinic, could be vague, number 1, 3, mostly clear, or 5, very clear. Autonomy, no matter who started those treatments, the patient belongs to that person. So let's say if you start treating a patient but you need to refer to someone, once that specialist is finished, they will refer back to you, so still you have that patient. Could be unclear, partial, or well-defined. Associate retention, very important. Number 1, it's a high turnover. Number 3, it's mixed. Or 5, it's a long-term loyal team. Shadowing, 4 if it's no shadowing at all. 3 if it's like basic, or 5 is structured. Scorecard number 2 is the clinic system and the culture. These categories make you happy to work there. So the categories here, we already discussed a little bit: the clinical support, chair-side support. I'm talking here about the nurse, rotating or untrained nurse, mixed experience or dedicated skilled nurse on your side. The patient journey, how clearly are they able to explain the patient journey? From picking up the phone or booking an online appointment until you provide the treatment and then they follow up. No follow-up system, basic admin support, or structured follow-up and complaint protocol. Emergency cover, again, who will look after if something goes wrong? It's unclear or they don't have any protocol at all. It's an informal arrangement or there is clear policy and coverage. Technological access, again, it's limited or restricted. Let's say, oh yes, we have an intraoral scanner, but only the principal dentist is using. Or it's available but minimal training. Oh yeah, we have a CBCT scan, but actually nobody knows how to use it. Full access or training provided, that's ideally, so you can give a score 5. The compensation clarity. Once you reach at the end of the interview, it's really important to talk about the salary, the percentage they offer, the lab fee responsibility, the minimum guarantee, and the payment schedule. The number 1 is the high associate turnover. If one of your colleagues doesn't like to work there probably it's a reason, so watch that. No mentorship available. It's really difficult, especially for a new graduate, to start working this kind of like a swim or sink situation. Unclear salary structure. If at the end of the interview they are not able to explain how you get paid, why would you like to stay on that clinic? Why you would like to sign any type of contract at all? Pressure to accept quickly. If they ask you, here is the contract, could you send it back tomorrow? Why should you send back tomorrow? If you're not a legal person, you need a solicitor, you might need 3 or 5 days even to check. And lack of patient flow clarity. So you need to understand how your patient ended up in your dental chair in order to treat and what will happen after once that patient left. On the other side, let's talk about the positive side. If they have a clear mentorship structure, a transparent compensation, a stable associate team, or let's say they offer, if you want to talk with one of our colleagues who graduated 3 or 4 years ago, we are really happy to give phone number and you could have a chat. How is working with us? Modern digital workflow and clear patient allocation system. Once you are done with all this information, then you can compare those clinics. There is a link below where you could download the digital workbook which we discussed today. If you like this video, make sure you check the next one where I give you 3 practical advices on how to talk about your hands-on experience as a new dental graduate during your interview if you have never worked in a dental clinic before. Thank you so much for watching and have a great day. Bye.